Victoria here, so welcome back. You've now seen Jodi's back, neck and shoulders aromatherapy massage. You then saw the legs massage, and today you're going to be in the clinic with me as I massage the abdomen, the arms, hands and wrists, the top of the shoulders, across the clavicle, and also into the neck, and a nice neck release. So stick to the end to see how Jodi feels after that. Okay, thanks for joining. And as I apply the essential oil of grapefruit, seaweed extract and rose, the aromatherapy oils are mixed with a lovely organic sunflower oil and a little calendula. So the abdomen can be quite sensitive, so I always extend care here, being aware of the sensitivity of the nerves and the skin in the stomach area. So this is a very light effleurage without that feeling of being tickled. It's really essential to not induce any feeling of nervousness or sensation of too light a touch. An aromatherapy massage is generally a light touch anyway, so there is a fine line. And now I'm following the direction of the large colon, which is an upside down horseshoe from the lower left hand area, if we're looking at the abdomen in this fashion, up, across and down. Once I've used both hands in that direction, then use one hand a little bit more firmly, and now the two-hand overlapping directional massage, mainly using flat fingers and palms. So this is always in the same direction, going up, across and down, and as my hands travel over the lower abdomen, I reduce the weight of my hands so that they are very light indeed over the lower abdomen, where the reproductive organs and the bladder are found. The overlapping side gesture is so nice to receive because it's an upward, relieving those muscles of the obliques in the side of the abdominal cavity. This is beautiful as well to have done. Overlapping hands, and they actually come off, lift away from the abdomen. And the reason this is nice is where the upper central abdomen is the solar plexus, which contains a Chinese meridian point, which we refer to as the AP, the anxiety point. It is somewhere that can feel full of tension, and it is so nice to have that lifted, almost like our troubles and cares are being lifted away. And now I'm focusing on a few key meridian points. These are acupressure. And once I've focused on them 2 or 3 times in a sequence, I then do another couple of effleurage and then lift off very gently, always mindful of the sensitivity of the abdomen. And having replaced the warmed towels and the extra sheet over the top, giving Jodi some extra warmth for all the areas now massaged. So that's the legs, the abdomen, and the hips. I'm now focusing on the arms. Having removed the edge of the towel, always sensitive to keep Jodi covered up in areas I'm not massaging, I first of all introduce the essential oils in a nice long effleurage, and then place one hand on the opposite shoulder while I use my flat palm to circle the elbow. In many people, the elbows can feel quite rough and full of tension, and so this circling is really nice to receive. I then focus on the bicep and tricep muscles, the front and back of the upper arm, before replacing the towel and using my thumbs on the forearm. Forearms are used greatly in life, and so this fairly firm massage, always applying pressure upwards towards the elbow where the lymph node is contained behind the elbow, then this helps the directional flow of lymph and circulation, also relieving any muscle tension and strain from the lower arm. And now, using a rotational movement, always supporting and holding at the joint, meanwhile rotating with the other hand. Now I'm using both thumbs symmetrically to work upwards in between the metatarsal bones of the hand, and now focusing on each digit individually and then each knuckle individually. Also a massage and a little pull. And the next finger, the index finger, massaging up and down, rotating one way and the other before supporting, rotating into the second joint, massage again. Now on to the middle finger, exactly the same again, massage, a rotation, rotating both ways. I'm always looking for areas of tension or that might be catching. This is a feeling that might be produced from things like arthritis or repetitive strain injury, any issue in the hands from previous injury or breakages that I'm always looking for in order to bring more relief and get rid of tension. And a nice stretch on that finger. And then finally into the little finger, working into the joint at the base of the finger, and then the knuckle halfway up the little finger. Another massage, and a lovely palm massage where I insert my little fingers into the gaps of the hand between the thumb and index and the little finger and ring finger. Meanwhile, stretch open the palm and overlap my thumbs, for a beautiful solar plexus massage up the hand, the wrist, finally into the forearm, and a gentle pull on the arm, and that relocates the shoulder onto the couch in order to lengthen and restore. And now working on the left arm, applying some of those beautiful essential oils that just smell divine. They'll be helping bring skin conditioning and stress relief, meanwhile helping relax and revitalize. First of all, some nice strong massage up the arm, always the strength going up to the heart. And then the same techniques from the other side, using my palm in a circling movement over that elbow. And down the bicep to the deltoid. And then into the tricep. Having replaced the upper arm and the towel to keep Jodi warm, I use my thumbs in this action on the forearm, and this creates the effect of Jodi's fingers, thumb and hand being stimulated and turning inwards as I push. This really shows me that she's relaxing into the movement and her forearm is benefiting. A nice circling of the whole hand into the wrist, replacing the towels, and then working my thumbs in a dual pétrissage movement around the wrist, which has just been circled, and then up into those metatarsals. We can hold a lot of tension and lactic acid, uric acid and crystals in this area, so it's so beautiful to have massaged, relieved, rotated. I normally find, depending on handedness, that the fingers can hold a lot of tension and into the palm and into the thenar muscle of the hand. Generally, obviously, that will be most people's right hands, and sometimes I'll feel that into the left, depending on their way of working and how much they use their right or left hand. Now into those knuckles, a massage, a stretch and a little flick. The flicks, like I did on the toes in the previous video's massage of the legs, will help with dispersing energy that can be stored up in the extremities, therefore in the feet, the hands and the scalp and face. And now for that beautiful relieving massage up into the palm, which is the solar plexus point, into those bones of the wrist, always upward, overlapping and circling. Finishing off on the forearm and a gentle pull before replacing and covering up to keep warm under the towels. here we are. Now applying oil along the clavicle, under the neck and round the shoulders. I always make sure I've got enough oil that it feels ready for a massage without feeling that there's going to be too much friction, but not too much oil that it will feel greasy or like the oil might pool. So very gently touching over the clavicle bone, alternating one hand and then the other with a gentle neck pull. This is just my way of introducing my hands to this area that has not been touched or massaged in this treatment yet. Once I've introduced with the effleurage, I then use my knuckles in a beautiful, symmetrical technique, expanding, widening my hands away from each other. This really helps with the lungs, the respiratory system, and we make sure that we introduce a good amount of pressure there, and that will help us breathe more deeply. Quite often we breathe quite shallowly without realizing. So join me in taking a nice long breath right now. Now I'm using my fingers for a raindrop effect. Fingers together and then fingers separated. A beautiful tapping over the breastbone, the clavicle, around the shoulders, stimulating the lungs, stimulating the skin, finishing with a lovely effleurage and turning the head. I'm using one hand to support the head and the other to effleurage around the whole shoulder, and then using my knuckles for that lovely petrissage knuckling effect around the whole shoulder bone, the top of the femur, round the trapezius, the deltoid, into the neck muscle called the sternocleidomastoid. And you see, I'm using my thumb as a lever. This is my pivotal point. This is the area that supports me while my knuckles are rotating around the circle of Jodi's right shoulder. And then they come up in a lengthening maneuver up the neck to support, lengthen and stretch. This is beautiful on the back of the neck to relieve tension, to absolve any pain which could be causing muscle tightening and therefore constriction of blood vessels, which can lead to headaches and even migraines. And now I'm pushing down either side of the neck, using my thumb to clear the very front muscle of the neck without putting any pressure on the front of the throat. And doing the same on Jodi's right side, this time using both hands at first, around that shoulder, creating some space, moving the pillow, overlapping hands, just reassuring and allowing that muscle to relax. If there was any tension there where Jodi was supporting her own head, then this massage just wouldn't work. It would be too painful for her. So, having effleuraged, I'm using my knuckles into the deltoid, around the back of the trapezius, and up into the sternocleidomastoid. Again, using my thumb as my pivotal point. And I've always got my wrist supported on the pillow, so I'm not straining myself in any way. And now I'm using that thumb over the front of the muscle to clear the way of any toxins and tension that might be obstructing muscle action and respiratory flow. When I find an area of tension, I gently exert a little pressure onto that muscle. There might be a knot there, but I'd only do it once it's thoroughly warmed up and knowing that she's not using or tensing that muscle in any way. I now remove my chair and stand up in order to give Jodi a lovely lengthening neck release. I'm always supporting the head so that she gives her weight thoroughly, overlapping hands, and then support the head so that it relieves its weight backwards. This lengthens the whole spine, including the neck. And then replacing the towel, securing the warmth so that she knows that the towel is replaced right up to the neck. And then a few long effleurages from the breastbone, across the collarbone, over the shoulders, and up through the head and scalp, each time becoming lighter and lighter. A little contact on the head, closing my eyes, tuning into the energy, and then across the shoulders to let Jodi know the treatment is coming to an end. Hi Jodi, you alright? Yes. Yeah. So you've just had a whole body massage, including the neck up to the scalp, and I'm going to be giving you a facial next, so I'm going to ask you to get dressed and seated, ready for a nice tropic facial. Okay. How are you feeling?
Very sleepy.
Yeah?
Yeah.
Are you feeling okay to get up?
Yeah.
Yeah? But your massage was alright?
Very nice.
Yeah? Any particular bits you preferred, or?
Nice pressure everywhere, but the back of the legs was nice.
Okay, that's probably because you're on your legs, on your feet quite a lot at the clinic.
Yeah.
Excellent. Okay, so I look forward to giving you a facial now.
Thank you.